Welcome to the State Technical Assistance webinar today. We thank you all for joining us. And as you enter the room, we would love for you to introduce yourselves in the chat with your name, your state, and your injury topic that you work on. Welcome, everyone. Thank you so much for joining us today. So as you're entering the room, we see that a number of you are already connected to our audio. So as you're entering, please go ahead and introduce yourselves to the chat. Let us know who you are, your name, your state, and the injury topic that you work on. Great, thank you all for joining us. So we'd love to say a brief hello to our presenters. So we have Clay. You can say hi to everyone. Hello. Clay. Terry, you can say hello.
Hello.
And Judy? Okay, we will continue working on that. All right, so thank you all for joining us today. We will get started. So today is our State Technical Assistance webinar. Our funding sponsor is the Health Resources and Services Administration of the U.S. Department of Health and Human Services. We are HRSA's primary vehicle for state technical assistance and training for child safety topics. Some Ring Central controls. If you're joining us for the first time, we have a mute button at the bottom and a start video button. We do encourage you to unmute yourselves and ask questions. You can also click on the chat at the bottom to enter in any questions or comments that you may have during the presentations. So you can join by phone or computer. If you're having any trouble with your computer sound, you can definitely call in. Please continue to mute yourselves when you're not talking. You do have the ability to unmute yourselves, and we encourage you to use it throughout the webinar. If we share any resources, they'll be in the chat. They'll also be in our follow-on email and posting on our website. We are recording the session, and we will post it to our site. And of course, as I've already mentioned, please continue to use the chat to ask questions, introduce yourselves at any time. Great. So today we will be talking about how to promote child safety programs to our attended audiences. So as many of you know, I'm Maria Cotratis. I'm from the Children's Safety Network and a co-manager of the Child Safety Learning Collaborative. And so I'd like to introduce you to why we chose this topic today. The topic of today's stall came about from one of our co-manager discussions, where we often discuss the needs of the states and jurisdictions that we work with in the Child Safety Learning Collaborative and come up with innovative ideas to offer more targeted technical assistance. So we know from the folks in the Child Safety Learning Collaborative that the summer months is often a slow time, as many partners are on summer vacation, and schools that make up a large part of our partners across child safety topics are closed. But we would like to offer you something to think about during these summer months, perhaps something that you can take with you into the fall. So how do you promote your child safety programs? What messaging do you use? How do you engage your partners and your audience? We want you to continue thinking about these throughout today's presentations and then into August and September. So we'd like to hear from you first. Let us know, you can either unmute yourselves. How do you promote your child safety programs? We'd love to hear from you all. You can feel free to unmute. You can also raise your hands or enter your thoughts in the chat. Do you focus on building and using your partnerships to share your programs? Do you work with your intended audiences to test messaging perhaps? Do you review feedback from the public about how they are learning about the programs they participate in? So let's take a few minutes to think about how you're already doing this as a group. So I see a couple of familiar names and some new names. So I won't start calling on you, but we would love to hear from you. So you can go ahead and unmute yourself and share. How do you do this in your programs?
I can jump in here and I can share that on our team, we really focus on building relationships with kindergarten through 12th grade educators. That includes counselors, teachers, administrators, and also parents.
Great. So you're really trying to get at a lot of different participants and the messaging across the different groups. Great. Joanne, I saw that you unmuted. Would you like to share what's going on in New Hampshire?
Yes, we have an excellent partner in the Injury Prevention Center at Dartmouth Hitchcock, and they're related to CHAD, which is the Children's Hospital at Dartmouth. And they do all kinds of promotion for children's health, not only like wellness programs, but also injury prevention programs. And our biggest event of the year is an annual bike rally at the New Hampshire Motor Speedway, which is attended by at least 400 people a year when the weather's perfect and we're not having a pandemic. And at that event, we have lots of tables set up with different safety topics. So it spreads the message for not just bike safety, but all kinds of programs. So that's our one big outreach of the year.
Great. So you're using this other event that's well attended, and folks are going to gravitate towards to spread your child safety messaging. That's fantastic. Great. All right. Would anyone else like to share before we move on? All right. Wonderful. Well, those are two great examples of how you're getting to very diverse groups of folks. So if you have any other thoughts, you can please put them in the chat and we'll be happy to hear from you. So I would love to introduce our presenters for today. We have three presenters, starting with Terry Miller. Terry Miller is the Safe Infant Sleep Program Manager for the Georgia Department of Public Health. She acts as the subject matter expert on sudden unexpected infant death prevention, and also supports programs and activities designed to prevent infant mortality and improve birth outcomes. So hi, Terry. Nice to see you. Thanks for joining us today. Judy Wendorf is our next presenter. Judy holds a Master of Educational Leadership from Cardinal Strict University. For the past 7 years, she has served as Children's Wisconsin's Community Education Manager, where she leads a team that designs online learning education resources for kids and markets those resources to educators throughout Wisconsin. And prior to going to Children's, she spent 11 years at Cardinal Strict University, where she served as the Director of University Outreach. And there she led a team that created and marketed continuing education courses designed for Wisconsin educators in need of licensure credits. Prior to that, she was a physical education teacher in the Metro Milwaukee area. So welcome, Judy. Hi, Judy. All right, and then we also have Clay. Clay Anton is the e-learning representative at Children's Wisconsin. He began his career at Children's Wisconsin as an outreach educator and youth development coordinator for the Teen Health Crew. Over the last 13 years, he has helped the Children's Wisconsin e-learning team reach over 94,000 students annually with online health education programs that promote health and safety. Clay also serves as a digital storyteller for community education and outreach. So thank you. Hi, Clay. Thank you all for joining us today. So we are very happy to have these three wonderful people with us today, and we really appreciate your willingness to share how you promote your programs. So as you can imagine from my brief introduction, these are two very different examples that you'll hear in these presentations from Georgia and from Children's Wisconsin. Terry's example from Georgia is focused on how they were able to get home visitors trained to use and provide safe sleep education. And so this is a key partnership to get the messaging and education out to the public. While Judy and Clay will share how they've developed a marketing plan for their e-learning programming, which is focused on the recipients of their e-learning, children and adolescents. So as you hear these two examples, think about how you can integrate what they've learned about their processes into your summer plans. How will you gear up to promote your child safety programs? So without further ado, I will hand it over to Terry. Thanks so much.
Thank you. Happy to be here this afternoon. And I can hear some feedback.
You sound okay right now, Terry. Would you like to continue on? Oh, you're muted now.
All right, so I just have feedback for some reason, but I can get through that, no worries. So thank you for having me this afternoon. I'm excited to speak with you all. I am the Safe Infant Sleep Program Manager for the Department of Public Health. We're funded from our Maternal Child Health Block Grant, but I do sit in the injury prevention program. And so most of my experience has actually been in child injury prevention. If you want to advance to next slide, great. But currently, since 2014, I've worked as a Safe Infant Sleep Program Manager, and we have launched the Georgia Safe to Sleep campaign. And this tells you a little bit about what our goals are here on this slide. And I wanted to focus on the second and third bullet point there because we really focus on education of professionals so that they can feel comfortable talking to parents and having conversations with them. And that's so families can make informed decisions about safe infant sleep. So that's a core of everything we do. So when we're promoting safe infant sleep and we're trying to work with partners, this is always the thing that we're focusing on. In 2014, when I did start, we didn't have a program in the state. And so a big thing that I did first off was a needs assessment. It wasn't high tech or fancy. I literally would just talk to local health department workers and ask, what are you doing? If you're not doing anything, why not? What would be helpful? And just talk to a whole bunch of different people around the state. In Georgia, we have 159 counties. And so without having any kind of program or policy that was existing, we also had 159 different types of education that was happening or not happening within the communities. And so from the beginning, we realized that we needed to meet the need that was in the community, and that was for education that was effective. And so we worked to develop safe infant sleep education for professionals and then also for caregivers. And we work to rigorously evaluate these education because we wanted to have an increase in knowledge, of course, but we also were looking at intention. So what was the intention to practice safe sleep prior to the education, and then what was it afterwards? And so we were able to do that. We had a large scale evaluation and had significantly statistically significant changes in knowledge as well as intention. And so with that is where we really kind of drives our partnerships and how we promote our program is by having something that we know is accurate and can help make education consistent. So you can advance, please. With our home visiting program, it also is housed in DPH, and so that made it a little bit easier. It's a partner program, although just being in the same state agency doesn't necessarily make it easy. It just so happened that we did have some common goals, which of course is healthy babies, and so that was something that was very easy to realize and align with each other. And so when we first started with our working relationship, I found a champion within the home visiting team. I I say we a lot when I talk about Safe Infant Sleep program, but I'm actually a program of one. So it's me. I say we, it's a global we, because there's so many advocates that help make the work possible. But I found someone within the home visiting team who was a champion for Safe Sleep and cared about it. And that's always been helpful for me with any outside partner, is even if you first talk to a director or the main manager or something, whenever you do find that person who takes it a step further and really cares about your topic, that should be someone that you cultivate a relationship with, because they're ultimately the ones that are going to help drive the work and keep things as a priority. So anyway, I found my champion. It was easy to establish our common goals and values. And one of the things that I really promoted and talked to the home visiting team about was that using our education would really help to save them time. At the time, I believe we had 28 sites throughout Georgia that were home visiting sites. And the education that they were using, even though it's something that's in all the programs and models for home visiting, Safe Sleep's mentioned as important, they were all doing different things as far as the type of education and when it was happening and that kind of thing. And so I highlighted the fact that using our education would make things accurate and consistent. It would help to make sure that the information being provided to families was being equitable. All families would receive information that we knew was beneficial. It would help to be able to save them some time so that the different sites wouldn't have to go online and try to find a training or create their own. And so we just really highlighted that efficiency, the fact that it would make things consistent and accurate across their sites and make it fair to all their families. So that's really what we focused on. And at the beginning, I just did occasional trainings, or if I was ordering some handouts. Another thing we did with our handouts, I'll order pads of 50 tear-off sheets. Instead of brochures, the pads of one-page tear-offs are cheaper to print, but they're also easy for folks that are out in the field to take with them. You can stuff them in a bag or a folder and always have them on hand. Brochures are more expensive to print, and they're bulky, those kind of things. And so like we even try to think it through in that way. How can we make it as easy and efficient for you as possible? So we would provide them with these handouts. If I was putting in an order, I would send it out to them and say, like, you guys want some, and then send them some free materials. And then as we've moved on, the consistency of the trainings became more frequent. And then eventually they had some leftover funding, and they're like, you know, this has been such a value add to our programs. We're going to go ahead and make a video training specifically for the home visitors. And of course, all of my time is offered free of charge. I'm like, of course, we're going to do this. And so we had provided a training for all of the home visitors during one of their yearly competencies. And I had asked them if they'd let me do a survey of the home visitors after the training. And again, kind of a needs assessment like I did in the beginning when we first started the program. I asked, you know, what was beneficial, but what wasn't? What do you find when you're working with families that I haven't addressed and that you need help with addressing when you're talking to a family in real life situations? And so with that information, we created a training that we hope would meet the specific needs of home visitors. And so my only ask from this whole process was that they would create a policy, and that they would put into policy for all their sites the expectation that training on safe infant sleep would happen for every new hire, and it would also be a part of every yearly competency, so that, you know, we know when you learn something, it kind of goes downhill over time. You know, you kind of lose some of the knowledge, especially with safe sleep. We have like 15 recommendations. It's a lot. And so I wanted that yearly competency added in there to help make sure that the information remained accurate. And they agreed to that. So that helped us to get it into policy. So even after I'm gone, no one's using my training anymore. They still have safe sleep is still important and still part of their trainings. So next slide. With this one, I was just thinking about, you know, promoting my program and how I go about it and just kind of brainstorming some ideas here. I would like to point out a disclaimer. I'm not an expert in how to promote programs. This is just kind of what I've tried to do over the years, and sometimes it works and there's been occasions where it hasn't. But for the most part, I've found that if I can really look at our common goal and our common values, it really helps. Like if you start there, then everything else kind of falls into place. And one of our things is like with safe infant sleep, we're so focused on promoting safe infant sleep that sometimes we forget that our actual goal is that we're looking for babies to reach their first birthday. And so I don't want to become so hyper-focused on my topic that I forget that my topic is the same ultimate goal that other areas have, such as our breastfeeding advocates, child passenger safety. You know, why do we care whether how a kid is strapped into a car seat? We all know why, because we don't want injury and death. And so it's the same thing with safe infant sleep. And so by focusing on that larger goal, that value that's kind of more universal, we've been able to justify, I guess, if you will, how we can collaborate. With the example of child passenger safety, we, you know, I make sure in my trainings that everybody knows that we have certified passenger safety technicians and they can get their car seat checked for free. And that is a good thing to do. And then in our CPSTs, they learn about safe sleep and where they can get more information, but they also learn that a car seat is not a good place for routine sleep. And they learn why, and they teach it to their families. And so when I have trainings where I'm, because of the new updates that came out from the American Academy of Pediatrics, I'm going to be putting together a training about that. It'll go out to all of our CPSTs for them to come and join us on that. And so we do collaborate in that way. And by doing that, we have that collective impact. They're not teaching safe sleep and going through a whole 20-minute training, but they are still supporting some key points of safe infant sleep and vice versa. We just started a collaboration with Chronic Disease and their tobacco cessation program. And we're actually doing it with the cohorts, the quality improvement cohorts. And so with that, again, it was just that idea of focusing on our values and why it matters. And so we were able to work with them. And I, again, just offered all my safe sleep advocates out there doing great work as a resource for them to tap into to get their information out as well, because it ends up being mutually beneficial. That last bullet point there, I questioned whether or not I should put that in, but just with humility, I just think it's important to always keep that in the back of my mind. Every time I work with a new partner, they teach me something about my own program or my, you know, own beliefs, and I always learn more, and it ultimately just makes everything else I do in my program better. And we can go to the next slide. And that's just in summary. And so I was timing myself here to make sure I don't talk too long. I will tell you, for that second bullet point there, a recent experience I had was trying to work with faith-based organizations. We'd done a organizational capacity assessment. We, you know, did a needs assessment with them. We were working on some ideas of how we could partner and be a good benefit to these organizations. And I had an opportunity. I got invited out to a group of local faith-based organizations in a particular county that come together to meet, you know, once a month. and talk about community issues. And I went to that meeting and I did my usual thing when I talked to my public health counterparts or my injury prevention counterparts. And I told them all about the data. And then I went into how we want to, address that data with this program and how we want to work with them. And at the end of it, everybody was still stuck on that first slide of data, and they never even heard the rest of it, I doubt it, because they wanted me to go back. And then we had to talk through data and how you look at what's rates and raw numbers and why this matters. And I realized I'd made a big mistake. I kind of knew it, but I still did it. I needed to have led with values, why safe infant sleep is important, why it matters to them and their community, how they can be a part of the solution. I should have focused on those things instead of leading with data. And so I think that's just a good example where even when things don't go quite so well, you can still learn a lot from it. It was a good experience for me. Back to that idea of humility, because it kind of taught me to think things through and not get too comfortable with how well things have been going, that I forget that I do need to put some effort and attention in how I approach different groups based on, what it is that's going to motivate them. And I think that's it. Next slide is just my contact information. I'm always happy to talk about public health, injury prevention, safe sleep, all the things. So if you ever have any questions or whatever, feel free to reach out. And I really appreciate your time and attention today. That's it.
Thank you so much, Terry. I'm happy to hear all of your amazing examples, and that the piece of leading with values and really speaking to the specific communities that you're talking to. And instead of focusing on data, they missed the entire point by focusing on the data first. I thought that was a really important point to know who your audience is and how to reach their, provide the messaging in a way that's the most acceptable and easiest to digest for each of your audiences. I also really appreciated the point that you made about using assessment to better understand the landscape that you're working in and to make sure that you're promoting your evidence-based programs. I think that's really important. So I would love for you all to let us know if you have any questions or comments for Terry. And please, you can either put them in the chat or unmute yourselves and say hello. And I see a comment from Jeannie, and I see a couple of comments from Jenny as well. So Jeannie, are you able to unmute yourself and speak?
Yes, can you hear me?
Yes, we can.
Okay. Well, I would just, I just answered the question about how you reach your different audiences. And so that's all I wrote about as far as with youth and how we utilize social media and paid media and do youthful graphics. And then we'll attend youth type youth conferences like FCCLA, FBLA to reach that audience. And our messaging with them is being able to make an impact on their peers in their community with whatever programming that we may want them to do. And then as far as parents, it's more of a shift to, hey, here's resources to help you navigate maybe a particular issue that that they may be facing with not understanding maybe safe sleep or child passenger safety. We have the resources and we have available information for them to use. So it's a little bit different.
Great, thank you for sharing your examples, Jeannie. Jenny has also added some comments in the chat as well. Jenny, would you like to unmute?
Sure.
Yeah.
So I was just recalling that I remember hearing from some members of our Florida motor vehicle traffic safety team in the Child Safety Learning Collaborative about efforts that they did utilizing social media, which is a very common platform for youth, and trying to engage youth in safety messaging and so forth, that they put together a competition where they encouraged youth to create their own TikTok videos promoting teen driver safety messaging. And there was a competition that then youth could actually win a prize for the best video. Rhonda, I see that you're on today from Florida. I don't know if you have more that you could share on that I'm not remembering, or other efforts that you've done in Florida along the same lines. And I think I also recall some other teams have shared in the past doing the same sort of thing where they encourage youth to help with designing the messaging, like doing billboard postering and other things, so that really the message that is reaching out to the youth group is coming from the youth group. And that can be a really effective way of curtailing your messaging to be most effective in reaching out to the group that you're trying to reach. We've been hearing also, about thinking about the other groups that we have to address in public health. And that's one of the challenges when you're promoting your child safety work, is that often your messaging has to be customized so that the same issue is being customized to reach different audiences and serving different purposes, but you're still addressing the same safety issue.
Great, thanks for sharing those examples, Jenny. Wonderful. Okay, so are there any other questions or comments specifically for Terry before we move on to Clay and Judy? All right. Well, if you think of anything else in the meantime, you can go ahead and put it in the chat, and we'll come back to it at the end of our presentations. So without further ado, I will hand it over to Clay and Judy.
That you can hear me. I've had some technical.
We can hear you.
All right, I'm going to test this out. Can you hear me?
Yes.
Yes, we can.
Thank you. So we're going to talk a little bit today about how our e-learning programs at Children's Wisconsin markets our bully prevention. A lot of what we're going to share with you today fits how we market all of our courses, and would give you, I'm getting some odd messaging here. So you'd be able to use these in many different ways. Children's has been offering these programs for over 10 years, so we've had some opportunity to do a little trial and error. Let's go to the next slide. So this talks about audience, and whenever you want to think about marketing, the first thing that you want to do is think about who your audience is and how you're going to market to those people. So in this diagram, you're going to see not just teachers, but counselors, school administrators, and then parents and families. Over the years, one of the things that we've learned is often when it comes to health education in Wisconsin, teachers aren't the only ones doing the educating. There are school counselors who are often assigned to be responsible for teaching health education. So you'll see later on in this presentation how we've made some specific connections and relationships with some school counselor groups throughout the state. School administrators are just always a great opportunity to connect with the people in charge in the school, and those who can kind of nudge educators into using different tools. And parents and families have always been kind of a cornerstone of our work, whether we're working with educators or other populations. We try to get them to share what we're doing with parents and families. Moving forward, this is an area that we hope will become more of a focus group for us. Can you go to the next slide? So it's important to talk about our whole team. We're kind of small but mighty. We are a team of 10. The sales team is responsible for, as I'm talking about, all marketing, evaluation with who's taking our courses, where they're from in the state, We have a development team that consists of 3 development coordinators who put together all of our courses and our content. We have 2 programmers who actually put it together and create online games that are connected and become part of the course. And then we have a technology team that is kind of a blend of those. So we have staff from the sales team who are on the technology team and staff from the development team. And their responsibility is to make sure that our LMS and our customer relationship management tool all work to gather the data, to allow educators to enroll their students, to make sure that when the students go into the courses that they are working. And then also on the technology team, we have one IS technologist who's available to us as kind of a consultant. So he joins us every week on Tuesday as we talk about our team. Can we go to the next slide, please? So specifically our sales team. So here you can see what each role is responsible for. So we have our e-learning representatives. Clay's going to talk a little bit more later, but they're really responsible for a lot of our relationship building. We have our communications and program specialists. This person is critical to us. She, in our case, it's a she. She has a marketing background and she's a great editor. Absolutely nothing leaves our department without her looking at it. She looks at it for grammar. She looks at it for tone. She looks at it to make sure that if we called something, you know, ABC on one page, that we're calling it ABC on the next page, so that we are being consistent throughout everything that we do. And then we have a technical specialist, and our technical specialist coordinates all of our data. This person is very familiar with our customer relationship management tool, is learning more and more about our LMS, and is there to really support our work as we host courses and then get students into those courses. That final blue rectangle with the arrow, arrow that is way over on the right, the marketing consultant. This is a piece that's really become important to our team. We have developed a really great relationship with a marketing consultant. It's a position that we hire on an as-needed basis, and this role supports us with all of our design work. So when you look at some of our posters and some of the other things that we hand out to schools, and you know, they just look so great, that's our marketing consultant. She really helps us put things together in a way that grabs the attention of the audience. Can you go to the next slide, please? So these are just some of our partnerships. So we have a really strong relationship with the Wisconsin Department of Public Instruction, and from them, we are able to have conversation around grants that are out, around what they're seeing schools do, so that we can kind of keep a pulse on what's happening in schools. Where should we be headed? What do we want to be thinking about as we are creating different programs? We also get access to subject matter experts on occasion through the Wisconsin Department of Public Instruction. And we have a strong partnership with Milwaukee Public Schools. They are the largest school district in the state. They're our neighbor. You know, the hospital is located in Wauwatosa, and Milwaukee is right next door, and we have a very close relationship with them. And again, it allows us to speak to them to find out what their needs are. How can we help support their work? What do their teachers need? In their case, we are able to either we used to go to the schools to give them some tutorials and work with them on enrolling students in our courses. With COVID and the pandemic, we have shifted that, and it's become something that we do online. We have a partnership with WTMJ4. They do a segment at noon. It's called Live at Noon. And so on occasion, we will use that opportunity to have one of our reps go and speak about our programs on television over the noon hour. We also partner with the Wisconsin PTA. So where you see Wisconsin PTA, the WISCA, the one below it, the Wisconsin School Counselor Association, these are a couple of groups that we've decided to sponsor. So we use marketing dollars and we choose a sponsorship level that's appropriate for us. And from there, we do things like present at their conferences. We have information in their newsletters. The WISCA sponsorship, the Wisconsin School Counselor Association, that sponsorship also allows us to do a couple webinars a year where we get specific face-to-face, if you will, opportunities with other school counselors to promote our programs. So oftentimes with the School Counselor Association, they are really tapped into our bully prevention programs as well as our Healthy Minds program. So we will oftentimes kind of shift back and forth between the two. And then the Wisconsin Health and Physical Education, or WIPE we call it, that's another group. We try and get to their conference every year. That's a really great audience for us as the health educators are there. And oftentimes by the time we get to middle school, that's where our health educators tend to play a stronger role in the delivery of health content. Within Children's Wisconsin, our hospital as an organization is a great resource for us. We tap into subject matter experts regularly. We can reach out to many of the different departments within the hospital, and oftentimes someone will step forward to say, I can help you with this. I'm happy to look at the content you're pulling together. The Safety Center is another group that we work with. The foundation helps us identify grants and partnerships that help fund the work we do. And we have school nurses. So Children's sponsors school nurses in 10 different schools within MPS, and they're a really great partnership for us as well. They utilize some of our resources, and we work with them to help promote the courses that we have within the schools. So those are some of the partnerships. And now I'm going to turn the rest of our presentation over to Clay to continue kind of pulling all of this together for you.
Thank you, Judy. Our marketing efforts continually evolve. So as we go along, we continue to innovate, to change things. And there was a huge paradigm shift for us when we used our partnerships in a way where it was building relationships. So it was no longer selling a curriculum or a product. It was building those relationships so that we could work together to reduce bullying and improve school climate. So as we went along, we included more of our end users to actually market our programs. So they join us for all of our presentations at conferences, and we really depend on them to market to other educators in the building and across the state. So for our marketing plan, it's so important for us to have a plan each and every year. Every school year, we update our marketing plan. And we have an overall goal or overreaching goal. Typically, it includes a number of enrollments. So we try to grow every year. With the pandemic, it was a challenge because schools were in such a state of flux and even chaos to a certain extent. So we had to kind of adjust our goals accordingly. We also want to consider any special programming, new programs that we are producing. We also want to consider some of the grant opportunities that we have. When we get grants from the state or other private entities, we want to include those factors in any kind of goals that we have around marketing and our enrollments. Another thing that is really important is to think about how we can market in different ways. So, for example, at conferences, we have hard copy postcards, we have teacher guides, we have banners, electronic copies. Social media is something that we have a great response on when we send things out social media. We have the benefit of being included or we have the benefit of being part of a large pediatric institution that has an incredible reputation. And when people see our logo on our materials, it means something. Oftentimes I'm at conferences, I'm out in the community, and I see people approaching me, and I can just tell that they're going to tell me a story about how they visited Children's Wisconsin before, their kids received great quality care, and that's such a help for us to be able to market our health education programs. Last thing I want to mention on this slide is that you know, we adjust our marketing plan as we go, and it's built within our meeting structure that we review this implementation plan twice a month, and we also perform PDSA cycles as needed, so we can continue to adjust based upon what we're seeing in the schools. Next slide, please. So this is sort of a great shot of us kind of bringing all of these materials together. So this is a picture pre-pandemic from our one of our best conferences. It's the Wisconsin Counselor Conference. Wisconsin School Counselor Conference is hands down our best conference every year. There's over 2,000 attendees, and these are our people. So when we come and present at this conference, it always feels great. It's kind of a huge lift for our team because we provide a resource that's greatly needed and appreciated. So you can see here in this picture, we have a booth. All of our branding meets brand guidelines for Children's Wisconsin. We have the banners. We have freebies. We know that educators especially really love the free stuff. They love the little stars and the pens and all those things that you can put at your table to give out. We continually run out of them, especially the stars. In addition to that, we also have like a raffle. So when they sign up, you can see on those blue sheets there, they sign up saying they're interested in the program. That way we get them in our system. So we use Salesforce as a data management system. So then they're entered into a raffle where they can win. At this conference, we give away 2 Kindle Fires. And that's always a fun experiment to see how many people will sign up and just how truly excited someone can be to win a Kindle Fire. There's definitely been some screams and some hugs along the way. All right, next slide, please. So here's another example of different ways that we market. So we have our website, and our website, you know, the front-facing part of the website is truly educator-based. It's kindergarten through 12th grade educator-based. So they can go to our website and they can learn virtually everything about what we do, the different program tracks. We have bullying, we have alcohol, tobacco, and other drug prevention. We have nutrition and physical activity, as well as pedestrian safety. We also want to market to parents as well. So we have a number of parent resources because we know the behavior often starts at home and can be reinforced at home. And we've made some efforts recently to include Spanish speaking materials or Spanish related materials as well. We've continually gotten requests from the schools to provide that resource. So that's always kind of it's something that we're aware of, but it can be difficult to figure out how the best way forward for that kind of undertaking. We also have a mailer. So we have a listserv that we're on that allows us to reach all of our educators that we have access to. We have a listserv, and with our marketing specialist that Judy mentioned earlier, she really helps us tailor each communication that goes out. So for example, at the beginning of the year, we have a big kickoff, and we talk about how it's great to be back in school, and we have a number of really great new programs, and hey, you want to come back to our website and log into your account and get registered and ready to deliver another year of courses. Then we also, this last thing here on the lower left, the cyberbullying, grades 9 through 12. We're really excited because we were able to offer something at the high school level for the first time. And our team found that it takes a little bit to grow those relationships, to establish those relationships that are so important to us. where we did a campaign. We actually did it was a pilot campaign for our cyberbullying program where we provided schools with a kit where they could do a school-wide awareness campaign in addition to delivering the course to a student leadership group. And then the schools would get all this great stuff in the mail, in the kit, posters, other materials to help them spread the word about cyberbullying and what to do about cyberbullying, as well as we gave each school $250 to spend on their continued efforts to reduce bullying and improve school climate. Okay, I think next slide. Yes, the question slide. So that's, in summary, that's kind of what we're doing with marketing. It's always about relationships. It's always about innovating, and to our earlier speaker's point, staying humble and kind of hearing what your audience needs directly from them, not telling them.
Great, thank you so much, Judy and Clay. This was very informative and helpful. I see a couple of comments from Jenny that branding is a key communication strategy, and that having a recognizable logo is one way to push out your messaging. And then using that bling that we all miss from conferences to push out your name and your logo front and center. And then you mentioned a couple of times, Clay, the use of Salesforce, which is a customer resource management system. And those can be effective tools in assisting communication campaigns, keeping track of different outreach channels, and how do you target your messaging for different groups. So we would love to hear any questions or comments from all of you for Clay and Judy. Jeannie, I see that you commented again, so if you could just go ahead and unmute, you can let us know your thoughts.
Yeah, well, I work for a governmental agency, so buying the fun stuff doesn't come easily. So what we can do is we have some really cool tools that schools can use, such as a photo booth with fun props for the kids to show themselves driving, and then that photo booth then creates then a social media post, and then we have VR goggles that do distracted driving simulation, and so all of those things can actually be checked out, and they're from our program, and so that's one way to kind of use bling to get interest in our program.
Jeannie,
Great.
this is Jenny. I'm going to just jump in and share another example I think that's very effective from Nebraska, where you also created a very portable means of communication with your GDL education card. Maybe you could share a little bit more about that. And I know the Wisconsin Motor Vehicle Traffic Safety Team did something similar, working with AAA and building off some of the communication campaigns AAA had, and building in, again, a card, like a wallet-sized card that people could have that had quick and easy information about driver safety. So maybe there's somebody who could talk about that today.
Yeah, our GDL card it's like basically a half of a 8.5 by 11 piece of paper, so you could put it up under this sun visor or in the glove compartment, easily accessible for parents and kids, so they don't forget what their driving restrictions are. And we just put a lot of work into getting that out to all different types of organizations. And actually over the years, we've actually changed the look of it. The first look was more like legalistic looking, where it was yellow and red and all the traffic signal stuff. And now it's more easier to look at, and it's got brighter blue colors. And so I think it makes it more appealing for people to want to engage with it.
Great, thank you so much. And I believe it's Sim put in the chat, using the photo booth really extends your audience and provides for new outreach from the norm. So, continue thinking about the ways that you can engage the end users, as Clay said, the folks who are supposed to receive this information actually use it. Think about your partnerships, how you can extend your messaging forward. And we really hope that we've given you some food for thought for the next month and a half or so before schools start reopening, and you can start thinking about how you can get your messages across all child safety topics out into the public. So thank you both. If you have any ongoing questions for any of our presenters, for Terry, Judy, or Clay, please feel free to reach out to them. So one of the things that we like to ask from time to time is, what will you do by next Tuesday? So we've given you this food for thought. We've had you think about different ways to engage your partners, to engage your audience, take that learning back. So what have you learned or heard on today's stall that you will immediately try or use in your work? We'd love to get some ideas of how you'll be integrating this into your work in the next week. And I won't put anyone on the spot, but oh, Joanne says that she definitely needs a logo for her program. All right. Great. Jeannie, look into if Nebraska has a school counselor conference. Great. So these are some really good ideas. Judy, did you have something to share? Okay. Great. Terry from Tennessee, remember that I'm communicating with several different audiences. That's a really good point. We don't just have the kids, we have the parents, we have counselors, we have teachers, we have everyone who's around it. And in a couple of different circles, you may have heard this idea of sociological saturation, where you get the messaging out as much as possible across all of your different venues, so that the people who are supposed to receive the information and actually use it are getting that information from all different sorts of sources, and they're getting the same messaging. So I know that Terry talked about that, like making sure that people are getting the same message. Great. Elio's keeping them informed. Easy does it on the data. Great. Logos can help you identify your program. Great. Wonderful. All right. So as you also see in the chat, Kate has put in our evaluation link. So if you can, please give us some feedback. We do use your feedback to improve and to update our topics for our upcoming calls. So you can always request technical assistance from CSN. You can access our resources on our website and also subscribe to CSN's newsletter if you aren't already on it. And if you happen to be at Safe States in Orlando and at the end of August and beginning of September, we would love to see you. These are our presentations. We have 2 learning labs, diversity, equity, and inclusion approaches in the Child Safety Learning Collaborative, and creating communities of practice, child safety networks, and then an oral presentation in the session on from the federal to local level, innovative approaches to firearm safety. So we do encourage you to say hello to us. We would love to see you and finally see some faces in person. So thank you all for joining us today. We do hope that you'll give us some feedback, some evaluation data. The QR code on the right is to that STAW evaluation. So if you want to just scan the QR code with your phones, you can definitely do that. Thank you all to all of our presenters and to all of you for taking the time to join us today and to talk about this important topic. We hope you have a wonderful day and a safe summer.